Okay, so for those who don't know me, I'm Kevin Maggs. I am a chiropractor here in Gainesville, Virginia. You can see on the map there, it's on Route 29, just south of Linton Hall and 66. I work out of a physical therapy practice. It's called Results Physical Therapy, but I am my own business in there. It's called Lively Health. I just rent space in the physical therapy office. It's a great place. They are fully equipped for rehabilitation, and it's a great place. Really nice front desk staff, and this is the room that is mine that I rent, which may seem sort of arbitrary, but the reason I'm putting that up there is because it is a private room. There's a lot of physical therapy places and chiropractors these days that have open facilities where everything that you talk about, everything that you see is open so other people can hear you. I have a private room, so it's all contained within there. And I treat you. I don't pass you off to other physical therapists or physical therapy aides or techs. If you come in to see me, you're with me one-on-one. So a little bit more about me. I teach a lot of continuing education classes for other healthcare providers. In this case, this is called active release techniques. It is a soft tissue based treatment technique. Obviously, in this case, I'm working on the guy's shoulder, but the point is, I teach a lot of soft tissue treatments for other healthcare providers to teach them how to do proper soft tissue work. I'm also a speaker and director of the USA division of the Running Clinic. So the Running Clinic is an international group of clinicians, and we teach continuing education classes to other healthcare providers about diagnosing running injuries, treating running injuries, gait analysis, footwear, you name it. If it has to do with running, we're teaching about it. And so we teach that internationally, and it's a lot of fun, and it's extremely evidence-based. It's all about the research. What does the research actually say about running injuries and diagnosis and how to properly do all that? It's a little frustrating sometimes in my office when people come in and they've been told by somebody that they have a certain diagnosis, and it's actually way off, and that's probably why they weren't getting better, which is why they come in to see somebody else. So we teach a lot about that type of stuff. So I think it's really important, if you're a healthcare provider and you're treating running injuries, that you are a runner yourself. So I've done quite a few marathons and a few full Ironman competitions. And I think that allows me to be, in the shoes, no pun intended, of my patients when they're telling me about various running injuries. I can relate to them. So that's a little bit about me. One other important thing is this group that I teach for, the Running Clinic, and myself, we have no financial interests with any running shoe companies or any running related products, which is important to mention because some of the things that we teach about in the class and some of the things that I'll talk about tonight seem a little bit maybe controversial. And I want you to know that what I'm telling you is what the research says. It's not what some company has told me to say. I pay for my own shoes. I pay for my own flights. I do all that. So I'm going to be giving you the research as it is and my opinion of the research. So if you have questions, I'd love to hear them, but I've allocated 30 minutes to this. The advertisement said 30 minutes. So I'm sure some of you have commitments after this. So if you have questions, you can write them in the chat and I will try to address them after we're done, rather than during the course, because I don't want to go long in case other people have commitments. All right. So this week we're going to be talking about the number one cause of running injuries. And next week we'll talk about, do biomechanics matter? And if so, how? The next week on the 14th, we'll talk about, do shoes matter? And if so, how? And then the next week, the final week, we'll be talking about performance. So we're not going to be talking about injury there. We'll be talking about how to become a better runner in terms of performance. So I hope I can see all you guys at those presentations as well. Today, the agenda is going to be 6 different points. The first one is the idea that humans were born to run. We have a lot of evidence of that. We're going to talk about a specific social problem that is addressed by running. We're going to be talking about that popular opinion isn't always best. We'll be looking at a specific study that took surveys of a lot of runners, and their opinions were a little strange, but some of them not so strange, but maybe not necessarily evidence-based. We'll talk about this idea of load versus capacity, and I'm going to really get into the running and knee osteoarthritis. I hear this all the time. Medical doctors and the general public feel that running really leads to osteoarthritis, and I want to talk about that. And then the last thing we're going to talk about is how much is too much. When you're looking at a training plan, how do you know how to alter your training plan for you specifically? So we will talk about all of that. So without further ado, we are going to get started unless anybody has any complaints about that. So back in like 2010, 2011, there was a book that came out called Born to Run by Christopher McDougall, and it was a fiction book, but it was based on the research of Dennis Bramble and Daniel Lieberman up at Harvard, and they're both anthropologists. And what they said with all of their research is that humans, by and large, evolved to be endurance runners. And we have a lot of evidence from anatomic and physiologic adaptations that we have in terms of, like, let's say, like we have tapered legs. And so when the leg is swinging through as a pendulum, less weight at the end of the pendulum makes it more efficient. You don't see that in like pigs or elephants or things like that, animals that don't really have a lot of endurance. We have long Achilles tendons. It's estimated that about 50% of our propulsive power comes from energy storage and release from the elasticity in the tendons. We have really long Achilles tendons. So we could go on about various things like that. The biggest factors are the fact that if you look at a quadruped, when they're running, their hind limbs and forelimbs come together and go apart like an accordion. And that regulates their breathing. Whereas we're bipedal, and so our breathing is completely independent of our leg movement, so we can breathe independently, which makes us a lot more efficient at endurance running. The biggest factor is our ability to dissipate heat. So we're really good at sweating, and from my experience with some patients, some people are a little bit better than others at sweating, which is unfortunate. But we can dissipate heat, and most animals are really poor at dissipating heat because they don't really sweat very much. They dissipate heat by panting. So this idea of persistence hunting there at the bottom is still prevalent in, well, I shouldn't say prevalent, it's still present in Africa, where let's say I'm in the middle of the Sahara and I see a big gazelle out in the fields. I can start running after it with my really slow human running, and it's obviously going to take off and it's going to go much faster. But it will overheat very quickly, and it will have to stop and rest and keep panting to dissipate heat. Meanwhile, I keep plugging along. It gets up, runs away again, but it can't go as far because it's still overheated. And this continues until I catch up to it and I have my dinner. And what is thought is, how do we catch all these animals when we're clearly slower than, an elephant can run faster than us, but they don't have the endurance. And that's what humans are really, really good at. So it really seems like we were anatomically and physiologically evolved to run distances. But unfortunately, this is what we have. And I'm sure a lot of people have seen this picture of our evolution. Most people don't run anymore, even though that's what our bodies were made for. And that's kind of unfortunate. What's even more unfortunate is the North American version of this, which is really bad. And I'm sure you guys have seen a lot of this. But it is a big problem. It is a social problem. So if someone's overweight or obese or just physically inactive, what we see is, a lot of heart disease, cardiovascular disease, diabetes, cancer, psychological problems. Like, it's much more prevalent for depression and anxiety in people who are inactive compared to people who exercise. But yet you see this warning on treadmills and ellipticals and all these exercise equipment. Before starting a physical activity program, you should consult your doctor. I think it's actually backwards. I think the risks of not exercising far exceed the risk of exercising. And so what really should be asked is, before starting a physical inactivity program, you should consult your doctor. because it's a much higher risk of all sorts of different things, including even mortality. If people exercise, the mortality rates are a lot less. I mean, obviously people die eventually, but the risk of dying is significantly less if you exercise. So if we look at North America in terms of obesity and people who are overweight, 70% of North Americans are overweight or obese, which is a big problem. So we have these international panels of health experts that have come to the conclusion through all the research that if you were to exercise 30 minutes out of the 1,440 minutes in a day, you're going to significantly cut your risk of cancer, heart disease, psychological problems, diabetes, and mortality. And so it's really important that we all exercise. And so, especially now, which is really interesting, what is the most easy way to exercise? What do you not need a pool for, or a bike, or an elliptical, or a gym membership? You just need to go run. Like, you can just put a pair of shoes on and go run. Some people even run barefoot. But you don't need a lot of equipment. So it's by far and away the easiest form of exercise. And considering the health costs of not exercising, it's really important, I think, that most people run, especially since we were evolved to do so. But the problem is injuries, right? If you look at different studies, injury rates in runners run from anywhere from like 20% to 80% in a year. And it's such a wide range because some researchers say an injury is if you have any pain. Some researchers say it's an injury if it takes you out of running. Some studies say an injury is if you have to go to a doctor. So it depends how they qualify what an injury is. But if you average it all out, about 50% of runners are injured in a given year, which is crazy. Like, we're by ourselves. Nobody's tackling us. We're just running. And 50% get injured. It's pretty bad. So unfortunately, the answer to this traditionally has been the modern running shoe with its, stiff heel counter and rigid sole and elevated heel and cushioning. It's an $85 billion a year industry. And normally when I'm teaching these courses, we ask the healthcare providers, how much research has been shown that running shoes actually reduce injury? And the answer is actually zero. We have no studies that say that running shoes actually prevent injury. So it's clearly not the way to go. So if we were born to run and we're not running, and when we do run, 50% of us get injured, maybe something's wrong with how we evolved, or maybe something's wrong with what we're doing. So the question then becomes, why? Why are all these people getting injured when they run? And so there was a paper that was done in, you can see here, September of 2019. It just recently came out. And what they did is they asked 1,000 runners about what they do to prevent injuries. Now, most of them had some sort of injury prevention, and we're going to get into that in a second. But for those who didn't, their biggest barrier was just not knowing what to do. So if you're in the crowd tonight as a runner and you don't know what to do, I hope we address that tonight. But let's look at the people who actually had an answer for what they use for injury prevention. So over here on the right-hand column, we have the percentage of respondents that used the answer on the left, right? So for example, 50% of people used stretching as a means of preventing injury. Changing clothes. I'm not sure how that's going to prevent injury, but 10% of runners think that. Orthotics. 26% of people think orthotics is going to prevent injury. And if you're wondering why I'm highlighting these, and I'm highlighting them in red, it's because we have no evidence that they prevent injury, or we have a lot of evidence that says they don't prevent injury. Bandages, bracing, taping, kinesio tape. Kinesio tape just got sued for millions of dollars, and they lost because they used to advertise saying that they prevented injuries. They don't. 1/5 of the people think that compression socks reduce injuries. I've heard this a lot. People think that they can't run on the sidewalk because it's concrete and it's harder, so they run on the road. The running surface doesn't matter. If you switch running surfaces quickly, then that might change. Like if you always run on a treadmill and then your body gets adapted to it and you run outside, maybe that's going to be a change, so that could cause an injury. But what I want to focus on here is this change to shoes, where almost half the people think that if you change your shoes, like shoes are appropriate for injury prevention. Okay, so the authors of this study made a point of pointing that out, and they said the fact that running shoes were regarded as an important aspect for injury prevention is probably because shoe manufacturers and running shoe stores generally claim to make runners believe that wearing a certain type of shoe can prevent injuries. So Mr. and Mrs. Author are trying to insinuate that shoes don't prevent injuries, which may be, a little bit of a cognitive dissonance for most runners. But they elaborate and they go on and they say, nevertheless, it has never been demonstrated that running-related injuries can be prevented by wearing a certain type of shoe or by matching the shoe to the foot morphology. So in other words, you hear this all the time. People have high arches or flat feet, and running shoe stores will say, okay, well, you need to be in this shoe because of your arch type. That has been totally invalidated in a number of different studies. It doesn't prevent injuries at all. That's not to say that if you have a specific injury that you can switch shoes at that point to mitigate the pain of that injury. That is true. But as a means of preventing injury, shoes don't seem to do that at all. It's never been proven. In fact, there's studies saying that it doesn't work. So if all that happens, what then? What is the cause of injuries? And before we get that, what I want you to understand is this concept. This is probably the most important slide that I'll show this week, or this weekend, is the body will adapt to mechanical loads so long as the applied load doesn't exceed the capacity for the body to adapt, which is a mouthful. But the point is, if you go to the gym and you start lifting a weight, in other words, putting a mechanical load into your system, your body adapts. How does it adapt? It gets stronger. Muscles hypertrophy and you get stronger. Women are often told to do weight-bearing exercise because it increases bone density. Increasing your bone density is an adaptation to a mechanical load. Okay, so we see all these different things in the body adapting to what it's exposed to. I mean, not to get too much into this, but what if you lived your life, or let's say you lived for 3 years in a bubble, in a little bubble. When you came out, do you think you would get infections? Because your immune system would be really weak at that point, because your immune system is kind of like a muscle. It gets stronger as it's exposed to things. So our body is really, really good at adapting to the environment that it lives in. And so this is one thing that we have to understand when it comes to running injuries, and frankly, most injuries, is this load capacity relationship. So the idea is load and capacity are in a bit of homeostasis. They're even. But if you all of a sudden increase the load beyond what the capacity of the tissues is, then you have a higher chance of getting injured. It's a pretty simple concept. So that accounts for about 80% of all running injuries. And that's pretty established in the literature. It's not about the shoes or the biomechanics, not that they are completely irrelevant. We're going to talk about that in the next couple of weeks. But this idea of doing too much too quickly has a really big effect on running injuries. And that's really the biggest cause of running injuries. So what do I mean by that? What I mean is a change, a rapid change in the load, whether it's the speed, the mileage, the terrain, if you switch to uphill or downhill, if all of a sudden you switch your footwear, if all of a sudden you read on Runner's World that like a forefoot strike is better than a rear foot strike, and all of a sudden you change like that, your tissues aren't used to it. And so you have a higher chance of getting injured. But it's also other activities, right? Like if we are running, let's say 30 miles a week regularly, everything's fine, our body's in homeostasis, and then we start doing like beach to body workout or P90X or something, that's going to increase the total mechanical load on our system over the course of what we're doing. So the total mechanical load is up, so we have a higher chance of getting injured. But it's also about decreasing capacity in terms of rest and sleep and depression. There's certain medications, certain antibiotics that really increase the risk of tendon problems, stress and anxiety. If you're a smoker, your body's less able to adapt to the loads. Tissue tolerance, if you have a previous injury, that's a risk factor for getting injured, again, because your tissue tolerance in that previously injured tissue isn't as good. Age, right? If you're going to try to get to 30 miles a week, do you think you're going to be better adapted to do that if you're 18 years old or if you're 60? You know, age plays a role in how our body adapts. And then running experience. We have lots of studies that say that beginning runners get injured a ton more than experienced runners, simply because their bodies are adapted to it when you're experienced. And it's a really big overlooked factor, this idea of capacity. People like think I'm a hippie when I ask them, like, are they sleeping well? Are they stressed out? And they're like, that's a little touchy-feely. Like, I don't think that really relates to injuries, but it does. So just to drive the point home, I want to look at some numbers here with sleep. Marlenga in 2017 followed over 2,000 children for 5 years, and those with poor sleep had a double the risk of injury, 114% increased risk of injury. Maluski in 2014, 160 adolescents. Those who slept less than 8 hours a night were 70% more likely to get injured. These are really big numbers. And I don't think people understand the effect sizes of how big of an influence these sleep and stress and whatnot have. Van Rosen, 2016, again, just a different way of wording it, but adolescent athletes who slept more than 8 hours of sleep reduced their odds of injury by 61%. And then Johnson in 2019, it wasn't adolescents, it was just endurance athletes. And there was a significant association between those who slept less than 7 hours and getting injured. But it was interesting, if there was a reduction in sleep, sometimes it was a 2-week lag in the increase in injury rates, but it was definitely a correlation there. And if we look at stress, it's the same thing. Nussbaum in 2017, he looked at high school athletes with stress fractures, and the only thing that they could find was lower sleep and higher stress in that group. Luana Main out of Australia in 2010 said she followed triathletes for a year, and they tracked their total training load and they tracked their injury rates. And if there was an increase in training load, there was an increase in injuries. But she also looked at their psychologic profile. So every athlete had to fill out a psychologic questionnaire at the end of every week. And if there was an increase in stress level, there was an increase in injuries, and that correlated to the increase in injuries better than the increase in training load. So in her study, stress played a bigger role in injury than the training load did. Messier in 2018, 300 runners followed for 2 years. Lower mental health quality of life and negative emotions were significant predictors of injury. And then they went on to say, contrary to several long-held beliefs, flexibility, arch height, quadriceps angle, rear foot motion, lower extremity strength, weekly mileage, footwear, and previous injury were not significant factors for the injury rates in those 300 runners that they followed for 2 years. So stress plays a big role in injuries. So we can look at it like, okay, if I'm stressed out, I shouldn't be running as much. Maybe I should slow the amount of running that I'm doing. And you can look at it like that, like reducing the mileage and intensity when life is treating you poorly. If your boss is being a jerk, or your spouse is being a jerk, or you're getting a divorce, or you're having a baby, or you're moving, whatever, if there's a change in life stress, maybe that's a point to maybe calm the running down a little bit. Don't stop it entirely, but maybe slow the intensity down or the mileage. But we also have to look at it the other way, right? Like if things are going great, if you just got a promotion and life is good and your kids are doing well in school, that may be a good time to be a little bit more ambitious and increase your mileage a little bit, because your body is really well adapted at that point to adapt to the loads that you put on it. All right. So this idea of adaptation is really, really important. And that's the number one cause of running injuries. But if we take that a step further right now, if I ask you, does weight training lead to small and weak muscles? The answer would obviously be no. I mean, we have some proof of that right here. But if you ask people about their knees, does running lead to joint damage and knee osteoarthritis? Everybody seems to think that running is quote unquote bad for your knees and it's going to lead to osteoarthritis. So if we take a look at that for a second, I'm kind of well versed on that topic right now because I was asked to do a presentation next week at the world's biggest online physiotherapy symposium. And you can see down here, what do they want me to talk about? Overcoming misconceptions of knee osteoarthritis and running. And then I was also on a podcast a couple months ago, an Australian podcast, where that was the entire topic of the podcast, is sort of dispelling the myths of running and osteoarthritis. So let's take a look at the research behind that. So if we look at this study by Alan Torngelli, this was in 2017. It was what's called a systematic review. So what they do is they look at all the studies that have ever been done and they break it apart. So they included 25 studies. 17 were included in the meta-analysis where you look at the actual numbers. And they said the prevalence of hip and knee OA in competitive runners was 13%. Now that's elite international based running. So like people in the Olympics, people in the World Championships, that's what they classified as competitive. So these people are destroying their bodies all the time. So they had a very high rate of osteoarthritis. Control subjects, in other words, non-runners, the incidence of hip and knee osteoarthritis was 10.2. And if you're a recreational runner, there's only 3.5% of recreational runners have knee and hip osteoarthritis, a significant reduction. We can't say it's because of the running. We can just say it's an association. But we certainly can look at that and say, if running caused osteoarthritis, these runners would certainly have a higher rate. So it definitely does not cause osteoarthritis. So where does this myth come from? So let's look at the immediate effects for a second at cartilage thickness in the knee, cartilage volume in the knee, and something called T2 relaxation time, which is an MRI procedure that sort of measures the water content in the cartilage of the knee. So if you run and you take an MRI right away, after you run compared to before you run, there's going to be a reduction in the cartilage thickness, a reduction in the cartilage volume, and a reduction in the water content of the cartilage. But if you wait, so in other words, this study did an MRI, had people go 20 kilometers for a run, did an MRI, waited an hour, and did an MRI again, you can see that there was a reduction in the cartilage volume right after the run. But if you just wait 1 hour, all the water returns back into the cartilage and it goes back to the same volume and thickness that it was before the run. So in other words, the cartilage recovers quickly. And again, if we go back to the adaptation idea, if you keep squishing the water out of your knee every few days when you're running, your body is going to adapt to that. It's going to want to have more water content in your knee. So it does that. If we look at this study that was done on repeated exposure, so they took a bunch of people who didn't run, they were completely sedentary, and they looked at what's called the glycosaminoglycan content, which is the molecules in the cartilage that absorb water. So if you have a high glycosaminoglycan content, you're going to have a high amount of water in your knee, in the cartilage. So what they did is they said, just 10 weeks of running, we're going to take these people who are completely sedentary, we're going to take an MRI, they're going to start a 10-week running program, half of them aren't, and then we're going to look at what happens. And what they found was in the runners, there was a significant increase in the glycosaminoglycan content after just 10 weeks of running. So this is an intervention that you can do to improve the quality and composition of the cartilage in your knee, which is pretty exciting. And then in statistics, this R value, that's the correlation coefficient. If you have over a 7 in the correlation coefficient, that's a really good correlation. So what they did is they said, is it dose dependent? So they looked at the amount of running that they did, and it had a really good correlation to the increase in the glycosaminoglycans or the water content. So the more you ran, there was more glycosaminoglycans in the knee, which is pretty exciting. What if we look at the long-term effects? So again, this was a systematic review of all the studies. 15 studies were included, and they looked at, some studies had follow-ups of less than 5 years, but some studies had follow-ups of more than 25 years of running. And what they found was that this odds ratio down here, if you were a runner, you had 54% less chance of having knee surgery due to osteoarthritis. Again, do we think that running causes knee arthritis now? Probably not. If we look at all of these studies, look at the number of studies up there, huge amounts of studies. We know that starting a running program increases knee cartilage strength. We know that runners may actually have thicker cartilage than non-runners. Running can decrease the probability of hip and knee replacement by over 50%. But if you're involved in contact sports, like even basketball, soccer, American football, things like that, there is an increased risk of arthritis, or if you're an elite runner. So it's kind of a bit of a Goldilocks phenomenon. We know that if you don't run, you're at an increased risk of arthritis. We know if you run too much, you are. But we're talking like 80, 90 miles a week. So if you're just a regular runner that's running 20, 30, 40, 50 miles a week, you probably have a very good chance that you're reducing your risk of arthritis. So let's go back to that question. Does running lead to joint damage and knee osteoarthritis? No. The duck says no. And that's pretty clear from an abundance of research. Okay, so let's get back to this adaptation thing. If we look at the line on the left there, that vertical line, that's mechanical stress. And if we look at time on the bottom line, everybody has this red line, which is the maximum capacity of what you can sustain. If you exert a mechanical stress that's greater than that red line, you have a good chance of getting injured. Some people are pretty low if they're sedentary, but if you're an experienced runner, you have a very high level of your maximum capacity of what you can take. It's a pretty simple idea. But we also have this purple line here that says, if you're applying this blue line down here represents the amount of mechanical load. If you're sedentary and you sit on your butt all day and you're below this green line or this purple line, which represents the minimum stress needed to create adaptation, over time, the capacity of those tissues is going to go down. Things are going to weaken, right? So it's the you use it, if you don't use it, you lose it type of idea. What if you exceed the red line and you actually damage the tissue? Well, the same thing happens. The capacity of the tissue ends up going down. So we don't want to be above the red line and we don't want to be below the purple line. We want to spend as much time between those two lines as possible, and that's going to increase the capacity of the tissues. It's a really simple idea. How do you know if you've gone over? Well, you're going to have some pain during, pain after, or morning stiffness. I just went through this with a patient today. We started out, she has never run, and she started running because she actually asked me if she could start running, and I said, yeah. We started her out at 1 minute of running, 1 minute of walking, 5 times. She's done it for a week, and now she has calf pain. Okay, that's fine. She exceeded that red line. I'm going to want her to take a couple days off to allow it to heal, and she's going to go back to running 3 times of 1 minute run, 1 minute walk. It's okay that you start that low. Your body will adapt. But she was frustrated that every time she tried running in the past, she got injured. I started her out really conservatively, and she still is starting to get pain. So her capacity level is pretty low, and it's all individual. So we just have to pay attention to this. So what that means then is if we look at staying adapted between the red and the purple line, that means if you're going to run 5 miles twice a week to get to 10 miles a week, you may be exceeding that red line, and then the rest of the week you're not doing anything down here below the purple line, and then you go above it again. So you're not spending much time between that red and purple line. But if you run 2 miles 5 different times, then you spend a lot more time between those 2 lines, and your body adapts better. In general, the body is going to adapt better with smaller loads that's applied more frequently compared to large loads that are applied infrequently. So we have to remember that when we're talking about running. Some patients are surprised when they come in and they're frustrated because if they're running, 4 times a week and they're getting injured, and I tell them, I want you to run more, they're a little surprised by that. I'm not saying I want them to increase their mileage. I want them to just keep the same weekly mileage, but instead of 4 days, I want them to spread it out over 6. So listen to your body. So the solution then, make all the changes gradual, right? Whether it's mileage, speed, footwear, technique, whatever. If you're experienced and not injured, don't change anything. Your body is totally adapted to what you're doing. If somebody convinces you that a pair of running shoes is, the bomb, that's fine. You can switch, but do it slowly. But you better have a good reason for switching because your body is totally adapted to that shoe that you're in. Pay attention to your sleep, your psychology, your work, your diet, and other physical activities. These are all things that we have to keep in mind. And above all else, stay consistent with the running and enjoy it. If we're not enjoying it, there was a study that was recently done where they asked people why they run, and less than 20% of people said because they enjoy it. Maybe they're trying to reduce their risk of death and cancer and all the rest of it, and that's fine if you want to do it, but try to make it more enjoyable. Run with a friend, run on trails outside in the forest, or listen to a podcast or something. Try to make it a little bit more enjoyable for yourself. So I'm going to leave you guys tonight with this quote. I love this quote, and I think it's really applicable to everybody, and I wish more people would follow that. So that's it for tonight. I'm going to stop sharing the screen, and I think I can pull up the chat if anybody has any questions.